Hello and welcome to this educational presentation on understanding Medicare for those approaching Medicare. My name is Barb Raby and I've been a licensed agent in Minnesota since 1995 and I'm certified to help individuals with Medicare plans. This presentation, however, is educational and has two goals: simplify Medicare and teach you how to make informed decisions. Note, I will not be discussing any specific plans today, and I am also not addressing those that may qualify for Medicaid. So let's get started. Our agenda will cover basic Medicare facts, original Medicare, also known as traditional Medicare, how to cover what original Medicare does not, and finally, enrolling timely. But let's start with a little trivia question. When was Medicare passed into law? Was it 1955, 1965, or 1975? And the answer is 1965 under President Lyndon B. Johnson's administration. So let's go on to basic Medicare facts. Medicare is a government health insurance program. You sign up through the Social Security Administration. Some call it joining Medicare. You are eligible at age 65 even if you do not retire. Certain people under age 65 may qualify with certain disabilities and withdrawing Social Security benefits. It is administered by a federal agency called CMS, which stands for the Center for Medicare and Medicaid Services. Medicare is basic, affordable insurance, and most individuals look to private companies for additional coverage. It was first created in two parts, A and B. And together, this is called original Medicare. And it is important to understand there are possible penalties if you do not sign up for certain parts timely. You may be able to delay Medicare if you are still working and on active group insurance. Here's an example of a Medicare health insurance ID card. Note that there is no Social Security number printed on this card as in the past. Between April 2018 and April 2019, the government reissued all beneficiaries a new card with a random number for fraud protection purposes. You will see the sample ID card shows that the person is enrolled in both Medicare Parts A and B, or again, what is known as original Medicare. Let's start with Medicare Part A. So what is it? This coverage helps cover inpatient hospital, skilled nursing facilities, hospice, and some home health. It's free if you've worked 10 plus years in Medicare covered employment and are eligible for Social Security benefits. Medicare Part B. This coverage helps cover doctor, other provider visits, outpatient care, many preventive services, diagnostic tests, x-rays, certain supplies. There is a premium associated with Part B, and this is deducted from your Social Security benefits or billed from the government if you are not drawing retirement benefits. So time for another quick question. In 2019, what is the standard premium for Medicare Part B? Is it $98.50 a month, $135.50, or $187? And the correct answer is $135.50 a month. It is important to understand that Part B is means tested. And if you are in a higher income bracket above certain limits, you will receive notification from the Social Security Administration if you have to pay an increased premium. So what might Medicare not cover? Well, both Parts A and B have deductibles. There's a 20% coinsurance on many Part B expenses. Most prescription drugs are not covered under A and B. An annual physical exam is not covered. However, do not confuse this with an annual wellness exam that Medicare does cover. Glasses, hearing aids, dental, most healthcare outside the United States are also not covered under Medicare. So now let's talk about private insurance. These plans are available to help pay for expenses not covered under original Medicare. Where you reside determines what plans you are eligible to consider. And it is important to understand the type of plan you may be interested in. So I'm going to talk about these 4 types of private Medicare plans. Medicare supplements, Medicare Advantage, Medicare cost plans, and prescription drug plans. Let's first talk about Medicare supplements. These are also known as Medigap, and these are medical-only coverage plans. There are different options or types of plans from which to choose, and these plans always pay second to original Medicare. Generally, these plans are not network-based, which means you can use any doctor or other provider that accepts Medicare. The plans are portable if you move within the United States and are guaranteed renewable. If you apply for a Medicare supplement within the first 6 months of your Part B enrollment date, you cannot be declined for coverage. After 6 months of Part B, you may have to submit a health application unless you have a special qualifying event. Note that Minnesota is what's called a waiver state. So the Medigap plans or Medicare supplements available here in Minnesota may be different than what are available in other parts of the United States. Medicare Advantage. These are known as Part C plans, an all-in-one alternative to original Medicare. Advantage plans bundle Parts A and B and usually the drug benefit. You do not use your Medicare ID card if you enroll in an Advantage plan, and plans vary by state and county. These plans are not guaranteed renewable. The plans must be approved by CMS each year, and individuals receive an annual notice of change each fall. In some cases, a plan may not renew. Advantage plans may offer additional coverage such as vision, hearing, and dental. Now we're going to go on to Medicare cost plans. These plans work like a hybrid of supplement and Advantage plans and can be a medical-only plan or can include drug coverage. You retain your original Medicare benefits. The plan availability depends on your state and county. In Minnesota, there are currently only 21 counties where cost plans are available, and these include Pine County, Aiken County, Carleton, and Kennebec County in east central Minnesota near our agency locations. Cost plans must also be approved by CMS each year, and individuals receive an annual notice of change each fall. In some cases, a plan may not renew. Vision, hearing, and dental benefits may be included in a cost plan. Finally, let's talk about Medicare prescription drug. These are also known as Part D and have only been available since 2006. They may be offered as a standalone plan or included with certain plans. The plans vary by state and county and have coverage levels, including what is known as the donut hole, and I will talk about that in a bit. Plans can also change from year to year and can even non-renew. There can be a penalty for late enrollment. It is also important to note that the Social Security Administration has subsidies available for those with limited incomes and resources with a program called the Extra Help. This slide is a Medicare Part D standard benefit design for the year 2019. Please read it with me from the bottom up. So in 2019, a standard Part D plan has a $415 annual deductible. This is an amount that the member must pay before coverage begins. Once satisfied, you enter into the initial coverage period, at which time you pay 25% for eligible prescriptions until the total drug costs hit $3,820. At that point, you enter into a new level of coverage called the coverage gap, or what is also known as the donut hole. At this time, your coverage works different. You pay 25% for eligible brand name drugs. The manufacturer is actually discounting the meds by 70% at the time of purchase, and the plan's paying 5%. If you're purchasing an eligible generic drug in the donut hole, you pay 37% for the cost of the med, and the plan pays 63%. Now, once the true out-of-pockets exceed $5,100, the most you will pay is 5% for eligible drugs. This final level of coverage is called the catastrophic level. And I know this can be confusing, and these figures change annually. Also note that this is a minimum standard plan design. Many plans that offer Part D coverage offer flat co-pays or even eliminate the deductible. You need to shop carefully, and we will talk about that in an upcoming slide. I want to bring to your attention again the Extra Help program. This is another reminder that those with limited resources and income may be able to get extra help through the Social Security Administration, which may help cover monthly premiums, annual deductibles, and prescription copays. To apply, contact the Social Security Administration or the state Medicaid office. The Minnesota Senior Linkage Line can be very helpful. Another option is to go online to www.ssa.gov/extrahelp. A few words on the Part D enrollment penalty. While Part D coverage is optional, if you choose not to enroll in Part D coverage and do not carry other prescription drug coverage that's expected to pay, on average, at least as much as Medicare's standard plan, you will be assessed a premium penalty if you later enroll. This penalty is determined by the Social Security Administration, is based on the number of months you went without creditable coverage, and it is added to your plan's premium. It's also a lifetime penalty. Examples of creditable drug coverage which would avoid the penalty are the VA, TRICARE, Indian Health Service, or many group employer plans. So our final question is a little knowledge review. Which plan is guaranteed to renew year after year? And the answer is a Medicare supplement. They are guaranteed renewable. So now, what plans are right for me and where do I begin? As shown on this slide, there are a variety of plan options for an eligible person to choose from. If you stay in original Medicare, you may elect to add a supplement with or without a standalone drug plan. Perhaps you just want a drug plan added to original Medicare as you're satisfied with the medical benefits from Medicare. If you are in one of the eligible counties that offer cost plans, you still are in original Medicare, and then you can choose to add a cost medical plan or a bundled plan that includes drug coverage. Maybe it's a better fit to have a cost plan and a standalone drug plan. You have the option with a cost plan how you wish to handle your drug coverage. Finally, another option is an Advantage plan. Note, most Advantage plans include drug coverage, so unless you have other creditable drug coverage, such as the VA, the bundled Advantage plan with drug coverage can be very suitable. Remember that plans available do depend on the state and county where you live. First things first, let's talk about Parts A and B enrollment. You apply for these benefits to the Social Security Administration if not already drawing your Social Security retirement benefits. If you are drawing Social Security retirement benefits, you will automatically receive your red, white, and blue ID card approximately 3 months prior to your eligibility date. So this slide shows you 3 ways to get this process started. The first number, 1-800-772-1213, is the national toll-free number for the Social Security Administration. The second number is our local Duluth, Minnesota Social Security Administration office, 1-855-863-3560. The online option to enroll in Medicare is www.ssa.gov/Medicare. And when do you begin this Medicare process? Well, there's a 7-month window surrounding one's 65th birthday, and the process begins the 3rd month prior to your birthday month. So for example, if your birthday is June 15th, you can enroll March 1st for a June 1st effective date. Note the effective date is the first day of the month in which you turn 65, and if your birthday's on the 1st of the month, you're actually enrolled the month prior. You can enroll until September 30th in this June 15th birthday example, but be careful as your effective date will be pushed out later. Work very carefully with the Social Security Administration on this matter. Considerations on choosing a plan. So there's a number of items I recommend carefully considering when choosing a suitable Medicare plan, some of which are costs, coverage, other coverage in force, simplicity and extras, prescription drugs, doctor, hospital choice, and travel. Everyone's situation is different. But let's first talk about costs. Are you clear on the premium that must be paid on the plan you're considering? Remember, the plan premium is separate from what the government charges for Medicare Part B. What about any deductibles? This is the amount before coverage takes effect. Co-pays, these are flat fees associated with a specific service, and the maximum out-of-pocket limit you may be responsible for. Are you more inclined to pay a higher premium and have predictable costs, or do you prefer a lower premium and pay as you go? Let's briefly talk about coverage. Do you understand the benefit structure, and have you gone through the plan's summary of benefits? I suggest one thinks carefully about their thoughts on change. Do you prefer the stability of the coverage year after year, or are you comfortable reviewing benefit changes yearly and possibly switching plans? Other coverage. What if you plan to continue working and have active employer group coverage available to you? What if you have coverage to the VA, TRICARE, or a retiree plan? Simplicity and extras. Do you want a plan that's all in one, so you deal with one company for both your medical and drug coverage and have one customer service number to call with issues? Are you looking to include the extras such as hearing aids, eyewear, dental, or a gym membership? Prescription drugs. It is important that your medications are reviewed, so they are on a plan's list of drugs called a formulary. Note that there are a number of methods to review and compare plans and look at how your specific meds may be covered in a respective plan. One very helpful tool is on the web at www.medicare.gov. You can actually call Medicare directly if you have questions on a formulary, or call direct to the plan you may be considering. If you're using an agent or other trusted advisor, they have tools to assist you in this important process. You want to not just check if your meds are eligible, but do any of your meds require a private approval or have other restrictions before being covered? Be sure you understand the levels of coverage and the donut hole we previously reviewed. Are you eligible for the extra help subsidy? Can you use your pharmacy? Might you have a late enrollment penalty? Doctor hospital choice. Depending on the plan you're considering, it is important that you understand if there's a network of participating providers. By that I mean doctors, hospitals, and other professionals such as therapists. I encourage you to ask if you can keep the doctors that you currently use and find out if your plan requires referrals. You should also ask about coverage for out-of-network providers. Travel. Very important. As you consider your plan options, consider how much travel you do now or are thinking about in the future. Do you take frequent trips, either domestically or internationally? Do you spend a considerable amount of time out of your home state, such as wintering in Arizona or Florida? Is there a travel benefit built into the plan you're considering, or does the plan offer access to a national network when traveling? Remember that plans can differ greatly on how travel benefits work. Now that I've introduced the topics to consider when choosing a plan, let's talk about when you can make a change. First, the annual enrollment period, or known as AEP. And this applies to Medicare Advantage, Medicare cost, and prescription drug plans. Remember, Medicare supplements will automatically renew each year. The AEP is also known as open enrollment. In Medicare, it runs each year from October 15th to December 7th. The annual notice of change precedes these dates and is due in your mailbox by October 1st. Be sure to look carefully at this notice so you can review both premium and benefit changes for the upcoming year. If you choose to make a change during the AEP, it takes effect January 1. There's also an important period called a special enrollment period, or known as the SEP. And this is a year-round period of time, and it's a time when one that experiences special circumstances such as moving or loss of coverage can choose another plan. Note timeframes for SEPs can vary, so be sure to check with Medicare, your plan, or your trusted advisor. There is no issue if you have a qualifying event. So where do you get help with all this? Well, our staff here at Town & Country Insurance is committed to making sure that folks aging into Medicare understand their benefits, choices, and the steps in the process. For information on attending an educational workshop or no obligation one-on-one consultation to discuss your needs, contact myself or one of my 2 licensed and certified colleagues. All of us would be happy to help you. Thank you for listening. We hope this information was helpful and you found it valuable. Have a great day.